Canada, Switzerland ak àddina wërngal képp Supersonix Money Transfer ñu ngi ci ànd ak yéen ak yónneekaay xaalis bu gën a màgg ci Gambia mën nga jot xaalis fépp fi nga ne bàyyeekoo kaatong ba koy na te doo ci am benn jafe-jafe waaw mën nga jot xaalis bàyyeekoo ci sa ay mbokk ak am di jàmma nekk ci UK, Europe, US, Canada, Switzerland ak àddina wërngal képp ak suñu yónneekaay xaalis bu màgg bi nga xam ne dafa wóor gaaw te noppale fii ci biir Gambia. Supersonix Money Transfer ñu ngi ci ñetti fukk ak ñeent dëkk ci biir Afrika ngir jox leen melowaay yu gën ci jotum xaalis bi nga xam ne kenn du ko laam-laamee saytu leen ñu ci Google Play Store wala App Store ngir mun a bindu ci suñ app bi di Supersonix Money Transfer app ndax ngeen mun a bànneexu ci suñ money transfer services yi ay mbégte rek la ak Supersonix.
Montata fa mo million jama wala le nyim pengota coronavirus musasa sotoringal si andin amala nyim mukelati wala nyim musulati amal sibo nyoto mo wini jama fata findu banko kan wala le nyim sasa soto andin ay faale coronavirus man jaral soto bari fanan akiba dima mumunti ay pengu soto le
for keeping you here all this while, but this is something unavoidable. We could not avoid it because of the delayed night work that we had yesterday. But we really appreciate your coming, and we want to thank you for accepting the invitation to be here to have this press conference with the minister, the honorable minister, Dr. Samate. I am Lamin Dampa, the permanent secretary. You have Buwa Dabo, that's the program manager, head of communication. You have Dr. Vite, that's the head of health services, and we also have Dr. Nyazi, the one in the white, that's the deputy director of health services. Yes, I think we can start, Buwa.
All right, thank you so much, PS, Honorable Minister, Director of Services, the Director, the Permanent Secretary, and the media colleagues here present. Good morning, so good afternoon to all of you. And again, I would also want to join PS to apologize for the late start of the program. Of course, it's beyond our control, given the fact that we are very busy and on so many things up to this early morning. But nonetheless, the most important thing is that we are here and to have these, as usual, the updates with regards to COVID-19 situation in the country and what messages do we have as a ministry for the people. This is very important, knowing that we know the COVID situation have taken a new dimension in the country. We've been witnessing a lot of an increase in the cases, and of course we received press releases from the ministry regarding this, and some of the interventions, response interventions that we have in place will all be disclosed to the across by the Honorable Minister. Now, without wasting much of your time, I will quickly allow the Honorable Minister to give a statement. And from there, we will have the question and answer, which is also very, very important. But the most important thing is what do we have as a ministry for the people. Thank you all, and I will now give the floor to the Minister to give the statement. Thank you.
Thank you. Good afternoon, ladies and gentlemen. I would like to present the situation of COVID-19 in the Gambia as of 29th July 2021. And the strategies put in place by the Ministry of Health and its partners in combating the pandemic. Since the recording of the first COVID-19 confirmed case, the country has recorded 7,962 confirmed positive COVID-19 cases, with 6,848 recoveries, 213 deaths, and 895 active cases.
Recently, 33 COVID-19 patients were discharged from the treatment centers, while 368 got discharged at least 10 days from the day of being positive, or from the day that they received their positive test. Currently, there are 93 patients admitted in the various treatment centers, and out of these, 37 are on oxygen. We currently have 10 people in hotel quarantine. Case fatality rate is at 2.8%. So far, 13,662 rapid diagnostic tests were conducted at the airport for travelers, and out of these, only 4 tested positive with the RDT and the PCR. They were all treated and discharged. All 7 health regions have been reporting cases of COVID-19, with the majority of confirmed cases in Western 1 and 2 health regions, which is from the Greater Banjul area up to Kallaji. We have seen a dramatic rise in the number of cases and deaths from COVID-19 over the last few weeks. As we look forward, our health system needs collective efforts and mechanisms to bridge healthcare needs with service provision to our communities. Thus, the Ministry of Health and partners continue to work on the treatment centers and other modalities to halt the progress of COVID-19 in the Gambia. The unprecedented and increasing impact of COVID-19 require the broadest range of humanitarian and public health partners working together. The breadth and range of societal impact of the virus means that the consistent engagement of communities is paramount in promoting and maintaining local action. This is premised on the fact that to break the cycle of transmission, each individual has to be responsible to protect himself and others. Each individual must be responsible for his own personal protection and the protection of others around him. In this regard, the Ministry of Health wishes to inform the general public that through the COVAX initiative, 36,000 doses of the AstraZeneca vaccine were received earlier on in the year. 15,000 doses of AstraZeneca vaccine were also received from South Africa through the MTN initiative. 10,000 doses of Sinopharm vaccine were donated from Senegal. And recently, we received 151,200 doses of Johnson & Johnson vaccines from the United States government through the COVAX initiative. All these are geared towards increasing the vaccination coverage in the fight against COVID-19 in the Gambia. In the first 2 days of the commencement of the vaccination program with the Johnson & Johnson vaccine, over 11,000 individuals have received the vaccine within those 2 days. With support from partners, the Ministry of Health is embarking on a nationwide risk communication and community engagement program. This is a continuation of what has been going on ever since. These processes include tracking rumors, collaborating with community and religious leaders, utilizing existing community-based early warning mechanisms, as well as existing feedback mechanisms, and COVID-19 vaccination campaign to curb the spread of the virus at the community level. The general public is still reminded that the wearing of the face mask is mandatory in public places. Face masks are necessary protective gears and should be worn properly. We urge all local face mask manufacturers to follow the approved production standards to offer safe and hygienic masks that protect the wearer and the general public. Locally produced masks must be washed thoroughly and dried before wearing. We advise mask sellers to refrain from the practice of allowing buyers to test the mask before buying, as this could lead to contamination of the mask and further enhance the transmission of the disease. Our analysis show that the largest share of COVID-19 deaths is among people over 65 years old and people with underlying conditions such as diabetes, hypertension, and asthma. We, however, are now seeing even younger people dying from the disease. We have discovered that up to 70% of the patients we are seeing now are infected with the Delta variant of the coronavirus. This variant is known to be more virulent, more transmissible, and leading to more severe illness. In the last 1 month, we have admitted 171 severe cases of COVID-19, out of which 103 were females and 68 were males. Of these patients, only 5 had received some form of vaccination. The majority had not received any vaccine at all. Out of these, we have recorded 24 deaths. There are still several seriously ill patients on oxygen treatment in our facilities. We insist that the general public continue observing the preventive measures to limit the contagion and spread of the disease. Everyone should continue keeping their distance of at least 1 meter from other people whenever possible and frequently wash hands. At this stage, more consistent, systematic collaboration with partners involved in the public health, humanitarian, and development responses to COVID-19 pandemic is needed. We continue to work on the treatment centers and other modalities of containment and prevention strategies to halt the spread of the disease. We are working very hard to have 3 oxygen generating plants for the country, 1 to be stationed in Edward Francis Small Teaching Hospital, 1 at the Edward Francis Small Teaching Hospital, Bakau Center, also called Deban Treatment Center, and the other at Bansang General Hospital. We thank the health workers for all the hard work and dedication in the control and management of COVID-19. We appeal to the imams, the pastors, the Sefolu, the Alkalolu, VDCs, politicians, government officials, and anyone who has people who listen to him or her to wear the face mask and practice hand hygiene, maintain social distancing themselves so that people who look up to them will also do so. We need to protect ourselves and all the people around us from COVID-19, as we have seen the infection take another dimension with regards to the virulence of the virus and the severity of the cases. We urge each and every one of us to be an advocate for the containment and control of COVID-19. Each one of us has an influence on one or more people whose lives, with the help of the Almighty Allah, we may be able to save by spreading the preventive messages to the people. Each one of us has a very important role to play in the containment of COVID-19 in the Gambia. With these remarks, I take time to thank you all so much for your kind attention and hope to speak to you soon. COVID-19 is here. It is real. It is killing people, and we all need to work together to spread the message so that the disease is controlled. Prevention certainly is better than cure. Once again, thank you very much for your kind attention.
Thank you so much, Honorable, for that brilliant statement. I think, as you said, we don't want to keep you here. I think this is a very straightforward message, which the Gambian people deserve to know. So, as you heard from him, the figures are rising, and people are dying. We are registering or recording severe cases. And this, as I said in my previous interaction with you, especially yesterday, that this should be news. People deserve to know these things because, as they say, knowledge is power. And if people know the realities, they will be in a better position to adhere to the recommendations that we are giving them. So I think it's important for all of us to take this message seriously, and we know that COVID is something serious. A lot of the services that we are also giving them, or we have in place for them, these are very, very important. As he said, we have 70% of the cases that we are seeing now are the new variant, the Delta variant. And the public need to know about this. This one is more serious than the former one that we have been seeing. And we are losing a lot of people as a result of this variant. We all have a stake, we have a very important role to play. Let's tell the people the realities. If you come across any misleading or false information, I think it's our duty to be fair to the government people to tell them the realities, that this is not true. We have come across in our, and we made mention of this in the statement, that we are doing, Rumo management, Rumo tracking. And we are hearing a lot of horrible false information, which is not helping the government. He himself said it yesterday during the handing over that before COVID, when health workers, gave an advice to patients or gave an advice to people, they take it. If they ask them to physical exercise, they will do it. If they ask them to take medication as prescribed, they will do it. If they ask them to watch their diet, they will do it. Why now when we say wear face masks, it can prevent you, and they will say, we don't trust that, we have to be sure. What are you going to verify? How are you going to verify it? These are very, very, very important. And I think false information is killing a lot of people in the country. That's what we have to understand. It's killing a lot of people, either directly or indirectly, whether you know it or not. And this is not fair to the people at all. Vaccine saves lives. Before COVID vaccine, we have been having a lot of vaccine in the country. No one ever said, can I know the potency of this vaccine? How effective is this vaccine? We all know about this because it has been tested several times until it's proven to be safe and effective. So not everybody can sit in this house on this couch comfortable and send an audio to say this vaccine contains this element. How do you know? What is the proof? So I think it's important for the people to get the realities, and we have to be frank with each other. As a people, we have to have love and affection for our own people. This is not fair at all. And I always say it in most of my talks. So I think it's important for us to adhere to this call. He's here for everybody. He's not here for Minister of Health. He is here as the leader of Minister of Health, safeguarding the health of this the health and well-being of the people of this country. So let's take note of that, and I really have to thank him for giving us these figures. These figures are all available online. We have it in our website, on our Facebook pages. If you want to be current on this, just visit our pages. You will get a lot of information. Again, he has done wonderful, and very soon, as he said, we will get oxygen generating plants in the country. This is a very good news, because we know a lot of people right now, as he said, over 30 plus are on oxygen. And more people might need this oxygen again. And you have seen what happened in India, when countries are supplying them oxygen, but they run out of oxygen due to the variant. We don't pray that to happen here. But with this leadership and with this focus, they thought it wise to work ahead. In case we need more oxygen, then we will have it readily available in the country. So we are having 3, one at TFSTA, one at Bansang and Denver. So this is a good news for all of us. But again, the most important thing is let's be vigilant, let's observe the measures. I think this is the basic. Wear the face mask, observe social distancing, wash hands. It's not a rocket science. Everybody can do it. So this is what I just want to elaborate on this week. As I said, we don't want to waste most of your time. We will go into questions and answer sessions quickly. Then from there, we will ask the PS to do the closing remarks.
Not much, because because VP Parita. Yeah, that's fine.
Not more than 3.
Yeah, that's fine.
Cases of the Delta variant was recorded, and what is the ministry doing to limit its spread?
How many cases of the Delta variant? Okay, was recorded. And what is the ministry doing?
To limit its spread.
Okay, to limit its spread. Okay. Can we have standard?
Yeah, my question, thank you very much. I'm on my question is with regards to the issue of the vaccine. Like the minister is alluding to, I think a lot of people are now taking the J&J, because many people, including me, trust the J&J, because it's also one son. But the main concern in society and among many people is the fact that despite taking the jab and still have COVID, I think probably the minister should take this advantage to give a brief description of the role that the vaccine plays in terms of helping the person, not necessarily having the virus, but if you have it, the role the vaccine that you think it will play.
Okay, thank you very much. As I mentioned earlier, 70% of the total number happens to be the Delta variant. The absolute number you can get from the director hereafter, but 70% has been found to be the Delta variant. Now, the Delta variant or any other variant, the strategies of containment are the same. Initially, there was a lot that was not known about COVID-19. Probably there's still quite a lot that is known about COVID-19. But what is known about COVID-19 says that has recognized the transmission pattern. And to stop the spread, that route has to be broken. That is, breaking the route from an individual that is infected to another individual that is not infected. That is how you break the cycle of transmission of infectious diseases. So if a person has the virus and the virus is in droplets, so if the droplets come from an individual that is infected and he stays in his mask, it will not get to the next person. or even if some escape, but the next person also has a mask and he breathes in, the likelihood is that his mask will also protect him from breathing in those droplets. If we wash our hands, probably our hands may be contaminated with the virus, but we wash our hands regularly. We wash out the virus. And we make sure that as we sit down, as we do things, we don't touch our face. And so you've all realized that maybe you've never seen me touch my face, have you? You've hardly ever seen me touch my mask. Even if I'm going to adjust it, I'll not adjust it with the hands here because they are the most likely to be contaminated. I may adjust it here or this, or I may adjust it with my facial expressions, facial muscles, without touching it. So we have to refrain from touching the mask itself. We've seen people also adjust the mask and they put their fingers behind the mask. Of course, if your hands have the virus, it will just inoculating it behind. And even keeping them there for you to take them in. So how we handle the mask itself is very important. And we've also seen people, unfortunately, it is when we even speak, saliva comes out. It is when we even speak, sometimes we get a little choked and we cough. And that's the time we want to remove it so people can hear us well. But I'm sure you've not also seen my face for a very long time, have you? Since last year, you have not seen my face, and we've been able to do it. So if we are able to put on the mask this long, when was it? Last year, April? We started the mask wearing, and that's the last time many of you ever saw my face. So why can't others also do that? If the health minister and his team have not dropped using the mask, I think who are the best people to learn the mask wearing from? Health ministry. Health advice is best learned from who? Health ministry. So if they are doing it consistently, why wouldn't we use them as examples? Why would we use other people as examples? Those other people and all of you and all of the other people should use the health ministry as examples. If you see the health minister walking without a mask, you can say, well, now I can throw my mask away. But the health minister and his team are wearing the mask every day when they're in public, so we have no excuse to say because Mr. A or Mr. B is not wearing, that is why we are not wearing. So how we break the cycle of transmission of the Delta variant or any other variant is to follow these rules, make sure we maintain social distancing, we wear the mask, we wash our hands, and anybody who sees signs and symptoms and signs of the disease, when they manifest the symptoms, they should report early so that they can be taken care of, and that will prevent the spread to other people, to our loved ones, and to any other person. And it also affords us the possibility of getting treatment early. Because just like any other disease, when people get treatment early, when they need the treatment and they get the treatment early, they tend to do better. Rather than wait until they develop complications. Some complications become virtually irreversible or difficult to reverse when there is severe lung damage, when there is compromise of many of the systems. Then it becomes a big challenge to reverse those processes. So those are all very important. Now, with coming to the second set.
You talked about there's a standard, the J&J, we have seen a lot of people taking it, but still there is this saying that even if you have taken the shot,
yes,
you are still going to get infected.
Okay.
How do we explain to the public?
So the concept is not that the vaccine doesn't provide any protection against infection. It is believed that it provides some protection against infection in the first place. But even if people get infected, they are not likely to develop the severe form of the disease. They may develop mild symptoms, which they may not even take note of. And because they are not likely to develop severe forms of the disease, that means they are also not likely to be admitted in the hospital. And that means they are also not likely to die from the disease. So that means it is protective. They may have the little symptoms, but because the body, you see, vaccines, the way they work, in a simple way of explaining, what they do, there are various types. They have elements that look like the virus itself in some form, or one part of the virus itself. When given to the body tends to see them as the real virus most of the time. That's how they work. Because the body tends to see them as the real virus, the body develops immunity. And it's a complex process, but the body tends to recognize it as a pathogen, as an infectious material, as a dangerous material. So if the body should see it again, the real form, the body says, oh, I've seen you before, I know you. Then the body starts to fight it early enough, and then it's not likely to progress to become serious disease. So this is what makes vaccines very useful. This is how they work. So this is the explanation. So that is why it is useful. People, and you have seen, of course, the number of people vaccinated in this country is not large enough to make certain comparisons. But we have already seen the trend that out of the people who got infected recently, who were admitted at the hospitals, how many were there? 171? Yeah. Yeah, sorry? No, the total, 171 or so. And only 5 of them had some form of the vaccine. The rest never had any vaccination. So when this data continues, we're going to analyze. We've seen a trend already that probably these people who got infected, probably they were because they were not vaccinated. That's the trend we have started seeing. So we think the vaccines are very, very useful. Now, with regards to the pandemic and the control and the your comments about us being lackadaisical, I think you know we've never been lackadaisical. We've been working hard, sleepless nights. You have witnessed that. Our team doesn't have weekends off. There's no Saturday or Sunday for any of us. We work Saturday, Sunday. This Sunday, myself, I went to see the patients with my team at the treatment center in Deban. All the patients I saw myself, physically, with everybody, with my team members. So we are not lackadaisical. We are up and about. And day and night, our teams are working in the labs, in the treatment centers, at the airports, at the border posts, on the radio, on the TV, in the communities, sensitizing the people, spreading the message. But the sad reality about the COVID-19 pandemic is, it is so unfortunate. As some people are spreading the good message, some people are spreading the bad message and undermining the process. For whatever reason, I do not know. But one thing I know is it's very sinful to spread the wrong message, because the wrong message, when it is spread, people who may believe it may not go out there for vaccination. They may be at risk. They may die from the disease. So you can imagine a person misinformed an individual, and the individual decides not to take the vaccine and he dies. But that individual alone who got infected and died might have infected many other people. That is the risk with infectious diseases. That is why when we do not know about something, let us not talk about it. It is better to keep quiet than to misinform the people. No government will benefit from telling its people there is a disease when there is no disease. What does the government gain from this? Government is struggling. Government is working hard. The people are working hard. The health workers are not sleeping day and night, running all around to make sure that we provide the care that the people need. But every system has a limit. If the trends continue, even big countries with large economies, you've seen the challenges they had with COVID-19. So we don't want to stretch our people, our systems in the Gambia to that limit. And we can, each of us, believe me, has a role to play. You mentioned about people not following the rules. To the best of my ability, when you people mention the president in these things, that I think the president is one of our strongest supporters when it comes to controlling and containing COVID-19 in this country. He's wearing the mask. He insists on hand hygiene. He gives us the support, the moral support, the material support we need to fight this COVID-19 pandemic. The president had canceled many meetings. You wouldn't know he canceled them, but he would have canceled because of the pandemic. Many meetings were canceled in this country that the officials of government were supposed to participate in because of the pandemic. So government has been trying. But you see, you need to understand governance. The leadership can say, let's do this. But there's no society in this world when the people don't participate in obeying the rules. There's no society where the rules can be enforced when the people do not participate. Have you seen a country where you can arrest everybody? Even with all, there are big armies. Even where there are big police force. Why people are able to maintain law and order in countries is because the citizenry understands that they have a responsibility to obey the rules and regulations. That is how all the democracies succeed. Because when it is the law now, whether the citizen likes it or not, he says, oh, it is the law, I have to obey it. Now, this is what we need in the Gambia. So it is not the executive, it is not the government, it's the people. Each and every one of us should play. If the traffic says this is one way, do we need a policeman to stand there all the time? Or we just need to know that it's one way and we don't enter there? I think we just need to know. But if one person goes and says it's a one-way road and one person goes and enters, maybe you have one or two policemen who will say, you know, arrest the person or do other, you know, and stop the person. But if everybody decides to drive that way, the police will arrest everybody. They will not. So it is our responsibility to obey the rules. That's part of governance. So government is there, but the people has a responsibility. Government gets to know what rules do we put in place. Based on COVID-19 guidelines, we say it is mandatory to put on the mask because of the evidence. Government puts that forward. It is now the responsibility of the citizenry to obey that rule. That's how it works. So we all have a role to play. Thank you.
Thank you so much. We are really sorry because Minister have another.
Yeah, give them one or two, then fine, so that because
Okay,
so we can.
It was you.
Yes.
Yes, and where are you from? Pardon Network, and who else? You? Where? QTV, Pardon Network and TV. Okay, Pardon Network, you can go ahead.
Yes, he made mention about people sending misleading and misinformation about COVID. To an extent, some wouldn't believe or take it serious. For me, I think this is because we have some people amongst the public who have been, in one way or the other, tested positive for the virus, and then they were later released. I mean, those that were in quarantine, later released and told to go. Just like that, without any form of confirmation as to how the ministry gets to confirm that we are okay now. So I was going to ask, is there any procedure where the person is tested positive, that is used in confirming if the person has indeed recovered. Because sometimes we hear thousands of people have recovered, but how do you get to know that these people have indeed recovered? So that's my question.
Okay. So as I mentioned earlier, COVID-19 is a new disease, and protocols have been developed with regards to the diagnosis, with regards to the treatment, and with regards to the follow-up. Now, initially, what used to happen was when a person tested positive and then undergone treatment, after some time, the person will be tested again and then tested again. So if there are 2 consecutive negative tests, that's when the person was considered cured and was released. But with increasing evidence, with increasing information, with increasing knowledge with regards to COVID-19, it was now thought that, and also adapting to the numbers, it was realized that the person may not have to test negative for the person to be considered cured, because some people remain positive for a long time, but they are not infectious. So that is why after 10 days or so or more, they are considered to have been cured. So they don't even, in fact, the protocol changed to a level that they don't even test them again. They just count, it's positive today, they count the number of days, and they assume that it's now not infectious, and they are allowed to go and consider cured. This is the answer. Yeah. So people need to understand that.
I think that message needs to get to the public.
Okay. So we will strengthen that message so that they will understand. A very good point. So that people get to understand really. And you have a good point that sometimes these details, as much as they may sound technical, but they enhance the understanding of the people. And Buba and his team, you need to incorporate that into your messaging. Yeah.
Thank you. Yes, QTV.
You talked about getting 3 oxygen generation machines.
You say, sorry?
You talked about getting 3 oxygen generation machines.
Yes, please.
How soon, looking at the story about coronavirus,
Okay.
how
So,
soon do you expect?
okay, so and I'm happy you brought that back, because I needed to shed more light on something. When we say we're getting 3 oxygen generating plants, it doesn't mean that there's no oxygen. There's oxygen. But oxygen is procured by the ministry and the hospitals from an oxygen supplier in town that has an oxygen generating plant in town, in Gambia, Banjul Oxygen. You know, but first of all, relying on one source is risky. If they have challenges, we pray that our demands are not beyond their capacity. But if that happens, it's a problem. What about also if the machine breaks down? Then it becomes a problem, because that had happened in this country many years ago, that oxygen had to be brought in from Senegal, and it was difficult. And that time there was no COVID. The oxygen was just for routine patient care, operations, and so on. So it had been part of our plan to strengthen all our health facilities. So we thought it is very important for us to have our own oxygen generating plants. These are big pieces of equipment. Some of them are in 20-foot containers. It's as big as that. It's housed in that. And they generate oxygen. So we want to connect them to a piped system rather than carrying cylinders. They'll be in the health facilities. For those of you who have been to Ndeban, you've seen pipes in the walls, and those are supposed to be connected to that plant when it comes, so that you don't carry cylinders anymore, and then you connect it directly. But these ones can also help us fill cylinders that will go to the minor health facilities. They are big ones, and I think it's a very big plus for the health sector in this country. One for Bansang, so that that part of the country also gets supply. One for EFSTH, Bakau Center, and one for EFSTH main hospital in Banjul. How soon they are coming, we are thinking in a couple of months. They are finalizing because these machines are not manufactured most of the time and lying down for somebody to come and buy. It is when the order is made, then they start manufacturing it. They were trying to finalize some details a few days ago with Dr. Bite, and then that confirmation, I guess, has gone now. So we are thinking in a couple of months we'll start getting at least the first one will come. But in addition, also apart from the oxygen that is procured from Banjul Oxygen, we have a whole lot of oxygen concentrators that we bought before COVID-19 pandemic. We didn't know there was going to be any pandemic, but we had bought them to strengthen the health sector and to provide for the health facilities. And even during the pandemic, we bought more oxygen concentrators. So these are smaller units, I'm sure you've seen them in the facilities, that can generate some oxygen also from room air, to a patient, usually one concentrator to a patient. Sometimes we split it, but most of the times it's 1-to-1. But their capacity is not as big.
All right, thank you so much. I think this brings us to the end of the press conference. And,
well, thank you very much for coming. Oh,
yes.
Okay.
soo bëggee jot xaalis bàyyeekoo UK Europe USA Canada Switzerland ak àddina wërngal képp Supersonix Money Transfer ñu ngi ci ànd ak yéen ak yónneekaay xaalis bu gën a màgg ci Gambia mën nga jot xaalis fépp fi nga ne bàyyeekoo kaatong ba koyna te doo ci am benn jafe-jafe waaw mën nga jot xaalis bàyyeekoo ci sa ay mbokka ak am di jàmma nekk ci UK Europe US Canada Switzerland ak àddina wërngal képp ak suñu yónneekaay xaalis bu màgg bi nga xam ne dafa wóor gaaw te noppale fii si biir Gambia Supersonix Money Transfer ñu ngi ci ñetti fukk ak ñeent dëkk si biir Afrika ngir jox leen melowaay yu gën si jotum xaalis bi nga xam ne kenn du ko laam-laamee saytu leen ñu si Google Play Store wala App Store ngir mun a bindu si suñ app bi di Supersonix Money Transfer app ndax ngeen mun a bànneexu si suñ money transfer services yi ay mbégte rek la ak Supersonix.
mun tata fo mo million jama wala le nyim pengo ta coronavirus musasa sotoringol si andin amala nyim mukelati wala nyim musulati amal sibo nyoto mo wili jama fata findu banko kan wala le nyim sasa soto andin ay faale coronavirus man jaral soto bari fanan akibar dima munti ay pengo soto le